Hello and welcome to another Blackwards journey into our history. Sometimes these journeys we take may not be a pleasant one. Today, the Tuskegee Syphilis Experiment stands as one of the most notorious examples of ethical violations in American medical history. Conducted over 4 decades, it involved the deliberate and callous exploitation of African American men under the guise of public health research. The study's implications have profoundly impacted the field of medical ethics and public trust, especially within the African American community. Understanding the origins, progression, and tragic outcomes of this experiment is crucial in acknowledging the grave injustices committed and ensuring they are never repeated. In the early 1930s, syphilis was a rampant public health issue in the United States, particularly in the South. The Tuskegee Syphilis study was conceived to address these public health concerns. However, the study's design and execution revealed a profoundly unethical agenda. The study was initiated by the United States Public Health Service to observe the natural progression of untreated syphilis in African American men. Macon County, Alabama, was chosen due to its high prevalence of syphilis in predominantly African American population. The men were told they were being treated for bad blood, a local term for various ailments. The Public Health Service offered free medical exams, meals, and burial insurance as incentives. The lack of informed consent was a glaring ethical violation. The study continued for 40 years even after penicillin became widely available as a treatment for syphilis in the 1940s. The recruitment of African American men for the Tuskegee Syphilis Experiment was marked by deceit and exploitation. Promises of free medical care and treatment were made to the participants, who were mostly poor and uneducated sharecroppers. The central ethical violation was the lack of informed consent. The men were not told they had syphilis, nor were they informed about the study's true purpose. Participants were subjected to frequent blood tests, spinal taps, and physical examinations. These procedures were not only uncomfortable but also carried significant risks. By the 1940s, penicillin had been proven to be an effective cure for syphilis, but the researchers chose not to administer it. Instead, they continued to let the disease progress, causing severe health complications and deaths. This decision was made to preserve the integrity of their study, prioritizing scientific data over human lives. The Tuskegee Syphilis Experiment is marked by a series of inhumane practices. The researchers subjected the participants to numerous painful and potentially dangerous procedures. One of the most invasive procedures was the spinal tap, performed to collect cerebrospinal fluid. This procedure is not only painful but also carries risks such as infection, bleeding, and nerve damage. The participants were not adequately informed about the nature or risks of this procedure. The researchers' primary goal was to document the neurological effects of untreated syphilis. In addition to the physical pain, the participants experienced significant psychological distress. Many men endured years of uncertainty about their health, believing they were receiving treatment. The most horrific aspect was the deliberate withholding of penicillin. This callous choice led to numerous preventable deaths and severe health complications. The inhumane practices reflect a profound betrayal of trust and a gross violation of medical ethics. The human toll of the Tuskegee Syphilis Experiment was immense and deeply tragic. The participants and their families suffered immensely due to the deliberate withholding of treatment. Many of the men experienced severe physical deterioration as syphilis ravaged their bodies. The disease led to painful sores, rashes, and progressive damage to the cardiovascular and nervous systems. The impact extended beyond the participants to their families, with many men unknowingly transmitting syphilis to their wives and children. This vertical transmission resulted in congenital syphilis, leading to severe health complications and infant mortality. The psychological toll on the participants and their families cannot be overstated. The discovery of the truth led to feelings of anger, betrayal, and a deep mistrust in the healthcare system. This mistrust extended to their families and communities, creating a lasting skepticism towards medical institutions. The tragic outcomes highlight the devastating consequences of unethical medical research. The Tuskegee Syphilis Experiment continued in relative obscurity for nearly 40 years, until it was exposed in 1972. The whistleblower was Peter Buxton, a social worker and epidemiologist. Buxton learned about the study in the mid-1960s and was deeply troubled by its ethical violations. Frustrated, Buxton eventually took his concerns to the media. In July 1972, journalist Jean Heller broke the story, revealing the horrific details to the public. The media coverage sparked immediate outrage. The exposure raised broader questions about the ethics of medical research. The Department of Health, Education, and Welfare launched an investigation, confirming the ethical violations. This led to the termination of the study and medical care for the survivors. The government's response to the exposure of the Tuskegee Syphilis Experiment was multifaceted. In 1973, the United States Senate held hearings to investigate the experiment. These hearings, led by Senator Edward Kennedy, were instrumental in bringing the details to light. Testimonies highlighted the severe ethical breaches and human suffering caused by the experiment. The hearings resulted in widespread condemnation and called for stronger protections for human subjects in research. A class action lawsuit was filed on behalf of the participants and their families. In 1974, the government reached a settlement, agreeing to pay $10 million in damages. The surviving participants and infected family members were granted lifetime medical benefits and burial services. The National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research was established in 1974. This commission developed ethical guidelines, leading to the creation of the Belmont Report in 1979. In 1997, President Bill Clinton issued a formal apology to the victims on behalf of the United States government. The legacy of the Tuskegee Syphilis Experiment is profound and far-reaching. The experiment's revelations have had lasting impacts on public trust in healthcare institutions, particularly among African Americans. One of the most significant legacies is the deep mistrust it engendered in the African American community towards the healthcare system. This mistrust has had enduring consequences, contributing to disparities in healthcare access and outcomes. The experiment also led to crucial changes in the ethical oversight of medical research. Institutional review boards, IRBs, were established to oversee research involving human subjects. The creation of IRBs has been instrumental in protecting the rights and welfare of research participants. The experiment's legacy extends to the education and training of future medical professionals and researchers. The Tuskegee study is now a key case study in medical and research ethics courses. By learning from this dark chapter of history, we can work towards a more just and ethical future in medical research and healthcare. The Tuskegee Syphilis Experiment remains one of the most tragic examples of ethical violations in medical history. The deliberate deception and exploitation of African American men represent a profound betrayal of trust and a gross violation of human rights. The exposure of the experiment in 1972 marked a turning point in American medical history. The establishment of the National Commission for the Protection of Human Subjects and the creation of the Belmont Report laid the foundation for modern ethical standards. It has left a lasting impact on the African American community, fostering deep-seated mistrust in the healthcare system. By remembering and learning from this dark chapter, we can work towards a more just and ethical future in medical research and healthcare. Thank you for watching, and check out more links in the description. What would the world be without a song?